Look for a product that contains benzoyl peroxide or salicylic acid, which can help to unclog pores and reduce inflammation. Tip 5. Protect your skin from the sun. Sun protection is essential for preventing premature aging and protecting your skin from damage caused by UV radiation. Use a broad-spectrum sunscreen with an SPF of at least 30, and be sure to reapply it every 2 hours if you spend a lot of time outdoors. In conclusion, taking care of combination skin requires a skincare routine that balances the needs of both oily and dry areas of the face. Cleanse your skin twice a day, use a toner, moisturize your skin, use a spot treatment for breakouts, and protect your skin from the sun. With these tips and tricks, you can keep your combination skin looking healthy, radiant, and balanced. Combination skin has both oily and dry areas on the face and needs tailored skincare for optimal results. The T-zone, including forehead, nose and chin, tends to be oily, while cheeks and the surrounding eye area can be dry. Use oil-controlling products on oily areas and hydrating treatments for dry sections. Wash oily zones twice a day with an oil-free foaming gel or cream cleanser. Look for salicylic acid or clay ingredients to absorb excess oil and unclog pores. Gently massage and rinse for less irritation. Wash dry areas once a day with a hydrating cream cleanser. Apply oil-free toners to oily areas after cleansing to tighten pores and mattify shine. Use hydrating toners with hyaluronic acid for dry areas. Look for oil-free, mattifying and hydrating claims. Target oily areas with lightweight oil-controlling serums containing salicylic acid, niacinamide, benzoyl peroxide, or alpha-hydroxy acid. Apply hyaluronic acid serums to hydrate dry areas. Serums provide concentrated treatments. Moisturize daily with oil-free gel or cream for oily zones and rich cream for dry areas. Look for oil-free, non-comedogenic, lightweight and fragrance-free labels for oily skin. For dry skin, look for hydrating, ceramide and glycerin ingredients. Use 50 SPF sunscreen daily on all areas. Exfoliate oily areas 1 to 2 times a week using facial brushes, scratches or chemical exfoliants like glycolic acid. Avoid exfoliating dry zones to prevent irritation and further dryness. Look for oil-controlling scrubs and lactic acid for gentle hydration. Manage oily breakouts with topical benzoyl peroxide creams or salicylic acid treatments. See a dermatologist for prescription medication if needed. Use a humidifier to add moisture to the air for dry skin relief. See a dermatologist for corticosteroid injections or medical devices for chronic dry patches.